Hello, I'm Dr. David Junkin with Seaview Orthopaedics. Following knee surgery, you may be prescribed a brace to protect the operative knee. There's numerous braces out there, but most commonly, the standard hinge brace is used. Whether you're getting an ACL reconstruction, having a tendon repair, such as a patellar tendon repair or quadricep tendon repair, or any major knee procedure that will involve isolating or immobilizing the knee. It is a standard hinge brace. It has multiple features. When you do wake up from the recovery room, the physician will have applied this brace to your limb, so you will not have to do any immediate treatment to the leg or adjustment of the brace. However, once you get home, you may find that the brace may shift, that you need to remove the brace to apply ice or other treatments for your wound, or even after you remove your dressing, you may have to adjust the straps to accommodate for the lack of bulk now that is no longer on the leg from the dressing. First and foremost, you should not have to worry about the middle dial here. It has gray tabs that adjusts for the range of motion. That should be preset by your surgeon, and you should not need to touch those. However, the button above, and again, they may differ by models, is typically the locking button. In this model, they have a picture of a little padlock, and right now it is locked, so it will not move. You just slide this up and it will allow the brace to move. And of course, you have to do it on both sides in order to bend the knee if you are instructed to flex the knee at any point during the post-operative period. In many cases, you won't have to worry about that, and the surgeon will just allow you to have the leg be held still until your first follow-up or until you initiate physical therapy, and the therapists are well attuned to these braces and can even show you some further details. Now, with regards to adjusting the straps, there's different ways to go about it. First and foremost, you have to release the straps, and typically it's just releasing these tabs. You can just lift it up and they should slide right off. Then on the other side of the brace, as the brace sits in this configuration around your leg, you'll notice that there are Velcro tabs. Some of the braces they're on the opposite side. You just release the Velcro tab, and then you can pull the strap and remove any slack behind the leg. Once you've removed that slack, you can lock it back in place, and then you can adjust this for any adjustment to hook back onto this tab here. What can be tricky with these braces is sometimes the Velcro portion will sometimes end, such as it does in right now, over an area where it will not adhere. You can easily remove the Velcro, keep that aside, then you may take a pair of scissors and shorten the strap if need be, and then you reapply your Velcro strap at your new length so that now the Velcro will stick. This is a telescoping feature. This is likely something that you will not need to be responsible for, that your surgeon may adjust this in post-operative visits depending on the needs and again the particulars of your surgery. This will allow the brace to collapse so it can become shorter or even longer if necessary. Again, you'll wake up in the recovery room with this brace in place, and it should be preset to the desired dimensions and locking position that your surgeon requires. Thank you for watching our walkthrough on how to adjust and use this brace. If you have any further questions, please call the office and we'll gladly answer those questions the best we can.